So thanks so much to people saying hello. Hopefully you're going to enjoy yourselves this evening, learn something new and get excited about taking some action. So look, a little bit of housekeeping. Can I remind everyone to please keep yourself muted during the call? And if you've got a question or comment, do feel free to use the chat box as we've got folks watching that, and that's exactly what it's for. I'm going to introduce our guest shortly, but before that, as usual, I'm going to give you my update on some of the things going on in the world that have been affecting the advocacy work that Results does to fight global poverty. And of course, we're also going to hear a bit about what you've all been doing around the country as well. So tonight I want to start by mentioning that this week it's Volunteers Week, and organisations across the UK are recognising the massive contribution that volunteering makes to our national life. There's a link that's going to shortly appear in the chat box to some resources on Volunteers Week from the NCVO, that's the National Council of Voluntary Organisations. Now, Results is a member of that. Some of you will probably have heard of that before because we often hold our Results National Conference at their offices in London, unfortunately, not for a while now due to COVID. So I'd like to take this opportunity at the start of Volunteers Week to say a massive thank you to everybody who's part of the Results Network. The advocacy work that you do as volunteer campaigners does have a huge impact in the world. And when on these monthly calls, I can share the impact you have on policy changes or increased political will or increased resources for poverty reduction, it just makes me so immensely proud to be working alongside you. And so I want to thank all of you from the bottom of my heart for the commitment that you make as a volunteer campaigner, picking up the pen, sending a letter, speaking out. Not everyone does it. It makes a difference. So whether you're a group leader or a long-standing group member or an individual advocate, or whether you're just brand new to these issues, your willingness to voluntarily speak out on issues of global poverty and injustice is so valuable. So in a little while, we're going to hear a bit more about what's happening during Volunteer Week from Ruthie. Now, for several months, I've been updating you about the cuts to the international aid budget. I'm afraid we have no more details now than we had last month, as the tremendous lack of transparency on the part of the government on this issue continues, alongside what appears to be a lack of planning as well. As such, there are some things we simply won't know until they publish spending figures retroactively in 2022. But alongside our allies in the sector, Results is keeping a close eye on how the ongoing international development work of the Foreign, Commonwealth and Development Office, that's the FCDO, the government department that spends the bulk of our aid money, is being affected by these huge reductions in resources. As we'll hear this evening, the fight against the COVID-19 pandemic is just one area that needs lots more resources, alongside the other areas that are being massively affected by it, such as global rates of malnutrition, infectious disease control, access to education, and much more. I said this last month, and I will say it again now. We have still not given this up as a lost battle. And our urgent objective is now to see how to get back to the legally mandated spending levels that we previously had, 0.7% of our national income. While it might not be so easy for you to see it, I can reassure you that the political pressure that you've helped build in recent months is really being felt by the government, who know they still can't win a parliamentary vote on this issue. We're seeing the run-up to the G7 Leaders Summit on the 11th and 12th of this month, hosted here in the UK as an important moment to keep up this pressure. There are a couple of things we'd urge you to think about. First, is there any more that your MP can do to put pressure on the government, such as asking a question or speaking in Parliament? Or if you've already done all you can with your own MP, and I'm pretty sure there's quite a few that have, is there someone else you know that you think you could get them to get in touch with their MP? If you can think of someone, would you share some of our action materials on aid with them and perhaps help get them into action on this important issue? Because of course, that would be absolutely brilliant, and that might even help you expand your results group. Now, our second ask is a bit more big public campaigny. As we know, a lot of you like doing that kind of advocacy too. And so we're asking you to please consider joining the hashtag Wave of Hope, all one word, no spaces, very modern, in the run-up to the G7 meeting. Wave of Hope is being run by the Crack the Crises Coalition, of which Results is a part. And again, we're going to put a link to all of that in the chat box. The aim of this is to also show public support for solving the crises the world is currently facing: the pandemic, injustice and inequality, and the climate and environmental crises, and that these G7 leaders of the world's richest nations, have a particular responsibility to step up and do something about the systemic inequalities which are doing so much damage to humanity and to our world. Lastly, I want to make a reference to a statement of the G7 finance and development ministers made last month in the run-up to the G7 summit on access to education. We strongly welcome their recommitment to getting 40 million more girls into school by 2026 in low and middle income countries, and 20 million more girls reading by age 10 or the end of primary school in low and lower middle income countries by 2026. But to make that happen, the financial resources have to be delivered, and it will be vital, either at the G7 summit itself or at the Global Partnership for Education's replenishment event towards the end of July, for countries to come up with the $5 billion needed for the period of 2021 to 2025 to fund the Global Partnership for Education to help make this a reality. If you took our March campaign action on this, thank you. We're hoping for the UK government, as hosts of both of these events, to lead the way. And again, it's absolutely not too late to take action on this. But that's enough from me for now. I'm going to hand over to Ruthie for the usual roundup of all your activities around the UK in the last month. Over to you, Ruthie.
Thanks, Aaron. And as Aaron said, it's National Volunteer Week this week. So I want to start as well by saying an extra special thank you and well done for that you do with results, your time taking action, having meetings, running events, and being here tonight and caring about all these issues. So this week we had the idea to kind of dedicate our Twitter and social media to you and all our volunteers. So we thought we'd start the roundup with something a bit different and take a few minutes to do something interactive so that we can start showcasing who you are, what you do, and celebrating you on social media for National Volunteers Week. So to have like a visual representation of where you're joining the call from and celebrate that you're up and down the country and internationally as well, I'm going to share a link to a word cloud, and you just click the link, type in where you are, and then it will come up with the answers in like a cloud shape with places that have been entered more than once appearing bigger. So I'm going to put that link in the chat, and if you just click it or copy it into your browser and then type in where you are, we'll soon have a nice visual show to see the answers. So feel free to do that whilst I'm talking. So as well as that, there are 3 other ways that you can get involved with National Volunteers Week on social media, and I'll talk you through them and also put the details in the chat. So firstly, if you're on Twitter, open up a tab or get your phone out and you can tweet why you volunteer with results. So you can either comment on the recent status, well, the recent tweet we had, or tweet from your own account with something like, I volunteer with tag results UK because, or whatever you would like to share most. And also we'll be using the hashtag Volunteers Week. Again, no gaps, as Aaron said, very modern. And yeah, so throughout the week, if you do decide to interact with us on social media for this, please do tag us and put in Volunteers Week as well. So if you're not on Twitter and would like to send something in to us, then that's also fine. You can email Della, our Campaigns and Communications Officer, with an answer in no more than about 50 words of why do you volunteer as a campaigner or advocate, and send your name, location, and maybe a photo as well. And we'll share those on social media or in a blog. And please, can you send them as soon as possible so that we can get it kind of going throughout Volunteers Week. And last but not least, you and your group are very welcome and encouraged to make your own content if you want to make something to put on your Instagram or Facebook, and tag us using the hashtag again. So there are some graphics in the link that went up earlier of templates for National Volunteers Week that you could use or adapt. So that was a bit of a whirlwind, but we're just going to have a pause the next few minutes, and you can write in the word cloud, get tweeting, or think about what you might respond to Della if you would like to. And yeah, then I'll carry on the roundup. So hopefully, if this goes well, we should start getting some answers on the word cloud. Can you all see this? Can you see words of places where you are?
Yep, it's all coming through nicely.
Oh, phew.
Vancouver.
Brazil, but not Linlithgow.
Oh, there's still some coming in.
There you go, William. You've made an appearance now.
Thank you.
To see you. I like how the Sea of Manchester's got a smiley in it. That's quite cool as well.
Let's see if it changes one last time. Okay, it's been like this for it, so I'm just going to take a screenshot. Wow, that is quite a spread of places, and places I didn't even know we had results volunteers in, so that's really great. Sorry, that slightly distracted me. I'll turn it off so it's not distracting me anymore. Thank you for everyone doing that. And if you didn't manage to, we'll leave it up a bit longer and I can take another screenshot later. And if you didn't manage to get onto Twitter in that time, don't worry, it's National Volunteers Week all week. So I would encourage you maybe to look at it later after the call or tomorrow, just so that you remember to tweet away so that we can see why you're involved, what you like about being part of results. And I'll put those options in the chat again. So now on to some event updates from Pool, which did feature on the word cloud. From Deirdre. So last month we heard about how preparations were going for Plant Sale, which was a fundraiser for results. And this month we're going to hear about how that went. And I'll be sharing some photos as well from the event. So Deirdre, over to you.
Okay, thanks, Ruthie. Well, we had an absolutely great event and we raised £500 for results. And this is a picture of Janet and Princess with some of the plants and their results t-shirts. The event was in 3 parts, really. It was, oh gosh, there we go. We had books. That's Fran. These are 2 very happy customers. There's my next door neighbour in the background who was taking all the money for us. We had books, plants and teas in the garden. And this is a nice, oops, it's gone. And this is a nice photo of, there's Angela in the middle. I think she's on the call tonight. This is Mike on her left, and that's Frida, and they're discussing the merits of one of the plants that I'd grown, I think. And she's bought a book. we were a bit bothered to begin with because we'd had terrible weather in the run-up to the event, and we had all those very violent winds and it was extremely wet. So we couldn't set anything up until the Saturday morning, but we managed it, and we were a bit cautious about whether people would come, but in the end everybody was very happy to come, and they sat and chatted in the garden, and we had teas and cakes and coffees, and we think that people were just very glad to get out and see friends. In terms of publicity, Harriet did a very nice flyer for us, which we could send out by email. As far as social media was concerned, I live in a biggish village in Dorset, which has a community Facebook site. So I could put the flyer on that and do some publicity that way. And we also put posters around the village. I had some feedback too on social media, people saying, which charity is it? And so I was able then to explain what we did. So all in all, we were really very pleased with the outcome. And of course, Results now gets £500, or has had £500 from us. Okay, thanks, Ruthie.
Thank you so much, and thank you to everyone who made that event happen and who came along to support you. It looks like it was really great. Just incredible amount of money raised as well from one day. So another event that happened recently was our Advocacy Training Day, which was inclusive and creative campaigning. And I'm going to hand over briefly to Naveed to give an update on how this went. Naveed is head of campaigns at Results and does a lot of preparations for these calls, but is often behind the scenes during them. So it's really nice to hand over to Naveed for a change.
Thanks, Ruthie, and hi everyone. Sorry, I didn't introduce myself properly at the beginning, did I? So yeah, it was a really nice training event. We had about 17 people turn up, and so this was on a Saturday, so that's really great. And we covered three things really. One was kind of how to be inclusive as a network, and obviously inclusion of different groups of people can cover all sorts of different people. We had an external trainer who focused mainly on the issue of race, which is obviously really important, and we're particularly kind of aware of that at the moment. And there was some really great discussions amongst the group, really kind of in-depth discussions about how to be aware of different things that you might not have been aware of before, how to try and start to reach out to people in different ways. And one thing that was really important that came from the kind of the trainer was it's really about learning and exploring and not being about judgmental about ourselves or others. So that discussion went down really well. And one of the things that the staff team is going to be thinking about now is kind of how to make a resource to help other people who weren't able to make that training, how to get the opportunity to start thinking about that yourself. So I hope other people got a lot out of it. There's a couple of people on this call who were there who may want to say something. The other two issues we covered was firstly how to have kind of a bit more exciting and interesting meetings. We've been doing a lot on Zoom, haven't we, for the last year and a bit, and it gets a bit samey. So we explored a few different ways of using things, a bit like the word cloud that you've just seen, and then also different ways of campaigning. So in addition to our bread and butter of the political actions, the letter writing, we covered a few more things that can do. We had a couple of examples of some social media activities that were a bit different and that different people could try. And one of the results of this was that Jill, who can see on the call, very heroically made and shared a video about her thoughts about nutrition. So massive thanks to Jill for throwing herself in and playing the game on that one, and it was a really great piece of advocacy, so thanks, Jill. I think that's all I'd like to say about the training, but I really enjoyed it, and it was great to hang out with everybody.
Yeah, it was really nice, and thank you to everyone who came. And so on to some other events that are coming up. The international conference, which is organised by our partners in the USA. The international conference is the 12th and 13th of June, so 2 weekends time, I think, although I'm surprised it's already June, so that's not helping me remember the dates. So we'll put the agenda and registration in the chat, and it's a really great opportunity to network with advocates from all across the world, join sessions. There's workshops on communications and media, sharing your story, a range of speakers, and also a session that might be of interest on global education, which includes Ziadin Yousafzai, who's the co-founder of the Malala Fund, and also Julia Gillard, who's the former Prime Minister of Australia and the chair of the Global Partnership for Education, which is the fund for education that over 50 of you wrote to Dominic Raab about earlier this year. So yeah, we'll put that in the chat. And also later in the year, it's the National Conference of Results UK, which again is an opportunity to meet campaigners, to come together, develop campaigning skills, and learn more about the issues we work on and campaigning in general. So watch this space as plans are underway. And yeah, September the 12th and 13th, and it'll be the morning on the Saturday and the afternoon on the Sunday. So 2 half days to break up the online Zooming a bit. Really quickly before I hand back to Aaron, I just want to thank everyone who's written to Wendy Morton about nutrition and urging the UK to recommit to an important target and also spend UK aid more effectively on nutrition. We've seen one reply from Wendy Morton, which reiterated the government's commitment on nutrition, which is positive, but there weren't direct answers to the specific asks. However, the reply did mention that the FCDO are working on new guidance on how the agriculture and economic development programmes can be designed to improve nutrition and how they can most effectively monitor the nutrition outcomes of these programmes. So we forwarded this reply to Mathilde, our policy advocacy officer on nutrition, and this was news to her and quite a few of her colleagues. So through that letter that was written by a volunteer, went to Wendy Morton, and then we saw the reply, we've now been able to forward that to Mathilde, and the policy team are now following up with the FCDO for more details on what exactly that guidance is, what it might look like for nutrition spending and also aid spending. So yeah, that's really shows the loop, I think, and we'll keep you updated on this, but it shows how your advocacy and the work of the policy team, the parliamentary team, and the whole of the Grassroots network connects together and strengthens what we do. And if you haven't taken action already, it's not too late. So yeah, the more letters, the more pressure, and we'll put a link again to the May action. So on that note, I'll hand over to Aaron so that we can move on to this month's action, the June action on COVID-19 equity. Thank you, everybody.
Thanks, everyone, and thanks, Ruthie. Just a real short remark on that last point, because I think I put it in the chat. This really isn't the first time that a results grassroots letter has revealed something that the government's been working on that has allowed us to take that news to the whole sector and really get the whole UK development sector jumping on that and doing even more detailed policy analysis and pushing it. You guys are just amazing, and the things that you guys find out through that process is just so incredibly valuable. So please do keep doing it. It makes a massive difference. On to the topic of tonight's call, which is the importance of a fair distribution of the world's supply of COVID-19 vaccines. Now, people recognized long before COVID vaccines were even developed that access to them would likely be very uneven. Sadly, these predictions quickly became true, as rich countries have not only pre-ordered billions of doses, but are also in control of the very companies and much of the manufacturing capacity that is needed to protect people right across the world, wherever they live, with the notable exception of the Serum Institute in India. Now, we actually have vaccines being rolled out during 2021. We're seeing the consequences of all of that. The statistics on vaccine inequality are stark, as I think we're going to hear a bit more about later this evening. So to discuss this and to show how a different way of procuring, manufacturing and distributing vaccines more fairly is possible, we're delighted to have with us Dr. Srinivas Murthy, who's Clinical Associate Professor at the Department of Pediatrics at the University of British Columbia in Vancouver, Canada. You saw it in the cloud earlier, so I think he's been with us for a while. Has recently been named Research Chair in Pandemic Preparedness. He's written about COVID vaccine equity and the dangers of so-called vaccine nationalism, which is where countries look to their own populations first, rather than cooperating internationally to ensure that distribution is primarily based on need and levels of risk, which of course has been shown to be more effective at protecting everyone from the pandemic overall. Dr. Murthy, just want to double check you are actually with us.
Yeah, here I am. Hey.
Oh, wonderful. There you are. Fabulous. Dr. Murthy, thanks so much for joining us from Canada, a fellow G7 nation, where I think the debates around this issue are perhaps similar to some of those we're having here in the UK. And we're looking very much forward to hearing your perspective on this massive global concern. As you can see, joining you on this conference call tonight, we've got volunteer campaigners from right across the United Kingdom, from Scotland to the South Coast. Lots of people who are very familiar with campaigning on global health issues. They're real experts on this stuff. They've been doing it for many years. And also people who are brand new and maybe just starting to learn for the first time about some of these structural issues in the world that prevent everyone from having equal access to the benefits of very necessary health interventions and other aspects of international development and poverty reduction. So our role at Results, of course, is to learn what the issues are and how grassroots advocacy can make a difference, most often by advocacy actions targeting our own government, being aware of the impact that that can have beyond our own borders and standing in solidarity with people right around the world. So look, before we go to the discussion itself, we always kick off with 3 pre-arranged questions, which of course we shared with you in advance, but I'm going to ask you to introduce yourself to people on the call, share a little bit about your background, your professional area of interest, and most importantly, something that I always like to ask our guests: what is it that motivates you personally to be active on this really important issue of equitable access to vaccines? What gets you out of bed in the morning to go and do that work?
Hi, everyone. Greetings from sunny Vancouver right now. In Canada. And so background for me, I am a critical care and infectious disease doctor out here in Vancouver at the university, so an academic physician. I have done research in sort of global health and global health equity for quite some time. And I'm I chair a WHO committee on COVID-19 and access to therapeutics there. I also do a lot of global research on child health all of this pandemic, specifically emerging and outbreak infections and access to care more broadly. And so I've been looking and thinking about these issues for quite some time. What gets me out of bed in the morning is I think this is a huge problem. And I think when we see problems and we see solutions right in front of us, trying to get from the problem statement to those solutions is what we need to sort of focus on. And I think that knowing where those barriers and obstacles are to get to the solution and where advocacy needs to be focused upon. And so I guess that's from this perspective, what gets me out of bed. And like the ultimate goal is saving lives. And saving the most lives possible from around the world of all the people who are sort of needing a scarce good and trying to figure out how to get it to them.
Thanks.
I'll stop there.
That's great. We always love to hear what motivates our speakers. We're going to jump straight into the first of our pre-arranged questions. For folks that we're going to then go to open questions afterwards, so you'll be able to unmute and yell out. But for those that would rather text those in, you can put them into the chat box if you've got access to the keyboard of whatever device you're using tonight, or you can send in an SMS on your phone to the number 0777 56 11178 if that's easier than going for the keyboard. I'll say that number again. But let's go to our first question and get rolling. And I believe that's going to come from London. I hope.
I think I have it. I can read it out if it's useful.
Well, I tell you, why don't I take the chair's prerogative and I'll ask it. I think maybe our London...
Oh, sorry.
Oh, here we go.
Oh, sorry. Hi, Dr. Murphy. Our question from London is, how different is access to vaccination and treatments for COVID-19?
I'm not sure if it's just me or if she's breaking up there.
I think, yeah, she did, I'm afraid. I think the question was, how different is access to vaccination and treatments for COVID-19 across the world?
Like, I think most people on this call probably know the simple answer there, that it's very starkly different across the world. And I'm not going to pull up slides or charts or anything like that, but like my country here in Canada, we're at about 65% of people having had a vaccine. Obviously, all the healthcare workers and all the vulnerable, and then scaled out afterwards to everybody. In the UK, it's somewhere around the same place as well, depending on how you measure it. In most parts of most low-income countries, they're touching maybe 1 to 2%. In most low middle income countries, it depends, but outside of India, they're in the 5 to 10% range. Upper middle income countries are in the 10 to 20% range. And so they're well behind high income countries. Like, obviously none of this is surprising for anybody on this call. You folks are a global poverty reduction group, and you know that the inequities exist. But I think the framing of this and how stark it is with a scarce good and the sequential nature of it being distributed around the world, high income countries first, and then low income countries in order, with likely like 60% coverage of most low income countries not projected until either late 2022 or early 2023, and many countries unlikely to get any vaccines for at least the next 3 to 6 months. And so there's a stark difference there. And with that stark difference comes differences in outcomes. And the outcomes we care about are people dying. And we've all been through bad waves in the UK and Canada. Lots of people have died in our individual countries, and that's obviously heartbreaking and sad. But remember, lots of people are dying elsewhere as well, and we're not necessarily tracking that as closely as we can. In Peru, for example, just this morning, they tripled their estimates of how many people have died because of lack of testing and lack of access to care and so on. And so while they initially reported X number of people have died, that has since tripled because of the excess and all-cause mortality during these past few months over the course of the pandemic. And so as these data emerge from parts of the world where we may not have access to as robust testing and data access as we do in the UK or Canada, I think we'll start to realize how stark those inequities are and how bad those waves are across the world. And it's especially concerning when we start to see, like, we have something that prevents this. Like last year, it was one thing. At this time, when there was inequities in access to care or so on, that would require a health system scale up, which was obviously challenging in many low-income countries. But now we have something, a small molecule that we have in a vial that exists that can prevent all of these illnesses. And it's just a matter of getting that small thing to people around the world who need it, and who need it very, very badly. And so the short answer to the question is, how different is access to vaccination and treatments? It's hugely stark. And I think there's lots of reasons as to why that is, which we'll get into in subsequent questions, I think.
Great, thank you. Excellent kickoff answer. Can we go to Lynn Lithgow, famous Lynn Lithgow, for question number 2?
Yes, well, we're very privileged to have such an experienced guest speaker. The question from Lynn Lithgow is, what barriers are there to lower income countries getting vaccines?
Yeah, so there's a few things there. Like, I think the first thing is the scarcity of the vaccine itself, meaning there's not much vaccine being made by all of the vaccine manufacturers. They're going as fast as they can, we're told, but there's not as much vaccine as the world needs, and the world needs not today. They needed it 6 months ago when we all started to get vaccinated. And so it's the scarcity more broadly. Subsequent to the scarcity, there's also the allocation. And so, like, there's a supply problem and there's a demand problem here. And the demand problem is rich countries taking that very scarce supply and taking as much of it as possible before sharing it with other parts of the world. And that's understandable because you want to protect your own citizens and you want to protect your own colleagues before you protect folks who you don't know and folks around the world who may not be visible to you. And this speaks to hugely complicated moral philosophical questions as how we protect people and who we protect, and whether someone down the street holds moral value or moral superiority compared to somebody who lives around the world on the other side of the planet. And so those are complicated questions that we don't have time to get into yet. What I can get into is how, like, from a public health perspective, regardless of whether you protect your neighbor before you protect someone from around the world, if you mostly care about the total number of lives saved, then the equitable way of distributing these vaccines is to make sure they get to the most vulnerable people first around the world and get to healthcare workers first so that health systems can keep going. And with that sort of base level of protection of everybody around the world, then folks can think about other people to protect, to add that level of protection to get to places where you can get herd immunity and economic openings and all the things that you're working on right now in the United Kingdom. And so I think the barriers to get there are first the supply. And the supply is sort of constrained right now by a few companies who sort of make these vaccines. Pfizer, Moderna, AstraZeneca, J&J, those are the main ones in the West, and the Sinopharm, the Chinese vaccine, and the Russian vaccine as well. And there are supply constraints there. What's being called on by specifically the South Africans and the Indian governments, in conjunction with dozens and dozens of other global South governments right now, not just advocacy groups, but advocacy groups as well, is asking rich countries to support them at the World Trade Organization, which is this governing body that governs global trade and global intellectual property, and asking the World Trade Organization to waive intellectual property, which is basically the patent right to own a medicine or the production of a medicine, to waive it for the course of this pandemic so that they can make their own vaccine supply for their own populations. There's been some, and this was like 9 months ago when this was proposed. Last September, it was initially proposed. And since then, most of the global North countries have been, no, you know what? This isn't the right way of doing it. We will make enough vaccine for you. And then we will give it to you at appropriate times as they become available. Obviously, it's 9 months later and they're still lacking vaccines, and looking at the projections for the next 6 months, it's still likely to be slow on that vaccine manufacturer. So it seems like the charity model for that supply idea is problematic. And so what the global South countries are asking is, like, we can make it ourselves. Why can't we just make it? And we have factories, we have some of the most dense vaccine supply chains in the world. You look at India, you look at Bangladesh, you look at South Africa, they have the capacity and the companies that are willing to make these vaccines, just that they're not allowed to at this point, and they're at risk of getting sued based on World Trade Organization laws. And so right now, that is basically where the globe is focusing its attention in terms of scaling up supply. Which is asking the World Trade Organization to allow global South companies to make this vaccine. And that means patents being waived. And so that means really less money for Pfizer, AstraZeneca, J&J, Moderna, and all of these companies, because they won't have the market to sell to in low-income countries, while other companies make that. And that's obviously a huge challenge as folks ask for things and they're not being given because of intellectual property. The second problem and barrier is the allocation problem. A while ago, last March, COVAX was started. So COVAX was a global initiative. The WHO and other sort of groups decided we're going to figure out a way of allocating vaccines to the world that's universal and based on need. Namely that healthcare workers and vulnerable folks, up to 20% of every population is covered by a vaccine that's available. And in principle, this makes a lot of sense. For a universal program, everyone buys in, everyone gets the same vaccine or some combination of vaccines, and they're distributed globally so that 20% of the world is vaccinated and vaccinated quickly. And if every country around the world had done that, we would probably be there now. Meaning that the globe would be 20% vaccinated rather than well below that, with rich countries being fully vaccinated and poor countries not being vaccinated. The problem is all the rich countries wanted to do that, but also get ahead of themselves in line and actually get all of the supply to themselves, taking supply, which is scarce, away from COVAX. And so you start to see barriers both in the supply chain and the supply of vaccines, and barriers from the demand perspective, whereby rich countries are taking it, not just from the companies themselves, but from COVAX itself. And so that means less vaccines to many parts of the world. It's all sort of coming to a head now with India, and India being the main vaccine manufacturer for the world, so that they have huge factories. Always for the past 2 decades, they've made pneumonia vaccines, they've made diarrhea vaccines. They've always been the vaccine manufacturer for most of the world. Right now, and they've been making the Oxford AstraZeneca vaccine for the past number of months. Because of their challenges with containing their own outbreak, they've decided that all manufacturing in India is staying in India because of the struggle that their health system is currently underway, and they're only about 10% of total population being vaccinated, which means that the rest of the world, who depends on those supplies, has no path to getting vaccine for the next 6 months until they're replenished in COVAX, which is obviously a striking thing to think about. The companies see this and think, okay, we can donate more vaccines and try and scale up things to get as much donations out there as quickly as possible. But that sort of doesn't really solve the problem of these countries wanting to be in control of their own healthcare and these regions wanting to have sort of some justice attached to things.
Thanks, Dr. Murthy. That is a really powerful set of answers in terms of what the barriers are. We're going to go across to Stort Valley for the third question before opening the floor.
Okay, that's me. What mechanisms are there for increasing countries' access to vaccines, please? I know you've touched on it a bit, but...
Yeah, like the increasing countries' access sort of speaks to the supply. And I think there's a lot of technical things we can talk about as to who can make these vaccines and which vaccine can be made. Can the Pfizer vaccine be made in India? Can the AstraZeneca vaccine be made at scale enough to vaccinate the world? But the short answer is yes. Like, there are all sorts of capacities out there to make this vaccine. What's limiting them is, one, the intellectual property to even start making it, and two, support from the companies to share how they did it. And so just having the intellectual property is only one small step in the scale of things. The companies, the people who know how to make these vaccines, have to sort of hold their hands for the first little bit and say, you know what, you have to put this here, and you have to, this goes there. This is how you make it. And that, up till now, has, both of those steps have been lacking. And so, like, there's ways of getting around that, specifically like having that technology transfer component, not the intellectual property, but the technology transfer component be centralized and owned by the companies while still shared. And the WHO last March even said that this is going to be a problem, set up this global sharing mechanism for knowledge sharing, where the companies would still own the tech transfer process, but they could be sort of disseminated to all of these different manufacturers around the world. Unfortunately, it has not been used once since it was set up last March, and it continues not to be used. Just yesterday, Dr. Tedros said this is a shame, and called again for all of these major companies to continue to share their knowledge as to how to make these very useful and very life-saving vaccines. And that remains a controversial and difficult thing for many folks to get to, namely that we should share knowledge during a pandemic, when really that knowledge is really what we need to save lives. And so I think that's one of the main mechanisms for increasing countries' access to vaccines. The second mechanism is just giving them the ability to make vaccines. And this has been a long-standing problem where the vaccine supply chains have always been originating from the global north or India, and then being sent to various parts of the world. And so if you look at vaccine manufacturing in Africa, there's very few places outside of South Africa that have the capacity to do this. And that's been through years of underinvestment by the global community. And so once again, that's a focus of energy as to where and how these vaccine manufacturing hubs should be scaled up. Should it be only in the north whereby vaccines are sent? Or should it be a distributed model where vaccine manufacturing capacity can prepare folks for future outbreaks and future pandemics, knowing that booster shots and variants and all of these things will take many years of vaccines and vaccine manufacturing to overcome. And so remember, if we donate a vaccine today from the north, it doesn't solve their problem this winter when they need a booster, and it doesn't solve their problem next year when a new variant has emerged and they need to get a vaccine against that. And so this is going to be a chronic problem that's going to take many years to solve. And it requires these long-term thinking about how we scale up capacity around the world and how we share knowledge.
Thanks. What a great way to round out that set of 3 first questions. We've had a couple of really helpful questions come in the chat. Maybe we go to those. Peter's asked like 5 questions. I'm afraid, Peter, I'm going to paraphrase for you and maybe try and sum up there. So tackling this one, Peter says that he thinks that some countries are stockpiling or order multiples of their own needs. So is there really a shortage in terms of that, or is it just one that's been, I assume, artificially created by this over ordering? And then sort of also related to that, I thought Oxford AstraZeneca were offering their vaccine at cost.
Yeah, and so I guess 2 points there. So the first point, Oxford AstraZeneca is offering at cost. It's mostly less a cost issue and more a supply issue there. With India being the main manufacturer of the Oxford AstraZeneca vaccine, there's just not enough. And so regardless of how much money is able to be spent on purchasing something, even if it's at cost, even if it was free, it's still unable to be purchased. And I think I wrote an article, it's like all of the money in the world is useless if there's nothing to purchase in the first place. And then this first question is crucial. Like, some countries are stockpiling and ordering multiples, not knowing what to do with them, basically. And so here in Canada, this has been a chronic problem that we're struggling with, where we've ordered, I think, 10 times the vaccine that we need, with the idea that we may need boosters in the next 6 months to 12 months, and we don't want to be caught without a vaccine for our own population in that time frame. And so, like, that obviously speaks to, do we need to save for boosters in places like Canada and the UK versus giving first vaccines and some protection to everyone around the world? And this speaks to sort of hugely complicated ideas of borders and the importance of borders therein, and how we decide who gets to live and who gets to die, and all of these things that, like, I think you guys within the results community have probably thought about from a poverty alleviation perspective for quite some time. But this is really the first time, really globally, it's really come to a head, whereby we really have to think about individual sacrifices that we make in the north to help folks in the south and help folks elsewhere get to a place of some sort of equity. Is it going to be full equity around the world? I'm not a pie-eyed idealist. I don't think we'll get there in my lifetime necessarily. But is it a place where the basic needs of folks are being met? I think we can get there.
Thanks, Dr. Murthy. So I'm going to pick Harriet's question out of the chat, because there's a whole chain that flow on from those. But Harriet, do you want to ask your question out loud? I know you've done that a few times in the past. I see you have a very fancy headset on. So,
yeah, hi, thank you. I was wondering how effective the Chinese and Russian vaccine manufacturers and distributors are, particularly in the countries where they have influence, which there are a lot of countries where they have influence. And so I was wondering how that fits in the global picture.
Yeah, like the challenge, like I wish we had better data on those 2 vaccines, and this may be like me speaking from my clinical trials Western perspective, but they haven't published their data in as sort of a clear and transparent way as some of the other manufacturers have. From the sort of observational data we have, they seem quite effective, and the second Chinese vaccine was pre-qualified by the WHO today and approved as being an effective vaccine. So it's somewhere in the 50 to 65% range, probably. The Russian vaccine, we're still waiting for some more data to emerge. And you're right, it's like they are doing a reasonable job of getting vaccine to places around the world. And part of that is diplomacy, and part of that is wanting to get a vaccine and this pandemic. And I think this speaks to how the world sort of needs to coordinate these processes better to better understand which vaccines should go where and how we can scale up supply to everybody. This isn't a West versus Chinese vaccine and who can get it first to places. It's getting the best vaccines to everyone as soon as possible.
Great. We're going to go to let people unmute and yell out their names if you haven't had a chance to type a question in the chat. And there's a few more in there that we will get to, but I want to make sure that we have a chance to folks that are maybe on the phones or otherwise want to just ask out their question. If you want to unmute yourself and say who you are. And if nobody jumps in, I'm going to put that same offer out to people that have typed a question. In fact, why don't we go to Carrie's question, because I think that's actually a really good one for right now. Carrie, do you want to? You're never shy. Do you want to read it out?
Oh, thank you. Yes. Hello, lovely to see you from Vancouver. Question is, where does Gavi fit into all this? We know we've done some work on Gavi along the years with results, and I'm just seeing. That's my question. Where does Gavi fit into this COVAX scheme?
And just to flag before you answer, some of the people on the call won't know exactly what Gavi is. If you give a 30-second overview, that would be really helpful.
So
it's the Global Alliance for Vaccine. It's an international fund which the most powerful countries pay into a fund, and it orchestrates projects and funding and channels information and resources into where it's needed for vaccinations across the world.
Yeah, and so Gavi it's been about 20 years. It's done amazing work at getting childhood vaccines to parts of the world that didn't have them, and set up supply chains and set up all sorts of infrastructure for getting vaccines everywhere. Gavi and CEPI, which is a similar organization focused on epidemic preparedness, the WHO and Gates Foundation are sort of the leading groups that are pushing COVAX as being a way of getting vaccines allocated fairly. And so they're really working hard, and they have been working hard at making sure that COVAX has enough supply to allocate. There are challenges, and I will be fairly clear that they've had challenges in how they've approached it. And they've approached it with the mindset that this is a scarce product, and the companies will make enough for COVAX and other countries to have. And so therefore, we should work on the company's terms to get vaccine into COVAX. And that, I think, my personal opinion has been that that has not succeeded, as we can tell in June 2021, whereby we have not had enough vaccines and we don't have a clear pathway to get enough vaccines. They have been shy on the waiving patents approach to things because of those relationships, those strong relationships they've always had to have with the main vaccine pharmaceutical companies and not the generic ones that could make vaccines at the same time. And so in the global health space, there's been a lot of controversy, and folks have probably been following the Gates Foundation and other groups and their controversies over these past number of months as to how the intersection between these large companies and these major multilateral institutions have and the large foundations, specifically Gates and others, and how those have all intersected to produce the situation that we are in right now. I mean, I could go on for quite some time, but I'm looking at the clock and don't want to take everyone's time as to say how those groups have had their challenges in getting vaccine available to folks, and how it's not always listening to the advocates from the global south who are looking for justice at this point.
Thank you. I'm going to go to Emily. Emily has put a couple of great questions in the chat, so I'm going to throw over to her and let her ask one or both of them verbally. Emily.
Thank you, and apologies, I haven't been on this call for ages. Lots of you will know me and lots of you won't. What are you referring to? Because I've anything in particular?
Ask your question, Emily. Go ahead.
Okay, so I put a couple of questions. There was one about early on in vaccines, I can't remember which one. It had to be stored at very low temperatures. I was wondering if that affected distribution. And the other one was more of it just seems a bit short-sighted, because it seems like everyone's holding on to everything to protect their self, but surely all those countries want to trade in open borders. So long term, that doesn't seem like a very good idea. And yeah, so it seems like long term, the current attitude would stop trade, which presumably is what the world runs on. So it doesn't make sense.
Yeah, like if the goal of all of this, or part of this anyway, is to have an economic recovery that's robust, then like there's great data and good modeling as to the fastest and best way to saving trillions of dollars in the global economy is to vaccinate equitably, meaning the world building a certain level of immunity and protecting vulnerable folks, saving the most amount of lives and livelihoods, and then scaling up accordingly. The way we're doing it now, where it's country by country and then build a wall across places that do not have vaccine with places that do have vaccine, that's obviously not going to be the most efficient economic recovery. It's obviously the short-sightedness of it. Like, yes, you want your neighbor to be vaccinated because you want to go back to the store and go back to the movie theater. But in the end, that's going to be a short-term gain for the long-term pain of what this pandemic will ultimately have.
And then the question on the cold chain.
Oh, sorry, yes, the cold chain. So yes. So the Pfizer and Moderna products do require a cold chain. That being said, like, places in sub-Saharan Africa have vast experience with cold chain for vaccine allocation, and that's partly because of Gavi and a lot of the childhood vaccinations requiring those cold chains. The Ebola vaccine, which I was involved with back in 2018 in DRC, that requires a tremendous cold chain, and that was scaled out to hundreds of thousands of people across rural regions in DRC and Rwanda and Uganda without really much challenge. A lot of work, but they can do it. And so because we say, oh, it's a cold chain, it can't go to poor countries, is sort of like not giving them the empowerment to save their own lives of their own people. Is there anything positive to hope for? I think so. I think we've discovered great vaccines, and I think we can really push our government, and we're working on it in Canada, and you guys can work on it in the UK, to see this as a global problem and not just a UK specific problem. And it's sort of crystallizing all of this connectedness that we all have. And that's why I'm speaking to you from Canada and you guys are speaking to me from the UK, that this is all of our problems and we all need to work on it together. And obviously this is a preamble, and I say this to every talk I give on this is a preamble to the bigger problem of climate and how this is the exact same problem we're going to have to face, but over the longer term rather than the short term of a pandemic.
Thank you, Dr. Murthy. That is a wonderful loop back around to the comments we made earlier about the Crack the Crisis big public campaign happening here in the UK, which does indeed bring in climate into the conversations that we're having around global poverty and the COVID crisis as well. So, but I think also a very positive note of global solidarity for us to end on. I think there's loads for us to do. I'm terribly sorry, but we have completely run out of time. It's gone past 9. I think we could probably spend hours talking to you, Dr. Murthy. It's been absolutely fascinating. And there are so many questions that we had in the chat that we were not able to dig into. For example, the question of vaccine wastage in some places, Bill Gates' role, the positive and negative of that, and the conspiracy theories coming around about it. There is a lot to discuss in there. I think we'll see what we can do about how we can figure out how to talk more on this topic, because we're clearly unpacking something really important and really big. But it's really clear to me, and you've made it even clearer tonight, that equity needs to be absolutely placed at the heart of our response. It's not just the right thing to do, it's the smart thing to do. And that is, it's really nice when those two things can align. So thank you so much, Dr. Murthy. Big thank you for bringing your professional expertise and passion tonight. We're going to pivot across to the final wrap up. So here's the ask. So if you can, please do take this month's action, which is to write your MP. and to ask them to urgently write to the Minister of State responsible for COVID-19 vaccines. That's Parliamentary Under-Secretary of State Nadine Zahawi, MP, asking for the UK government to urgently share surplus vaccine doses right now, this month, with the countries that need them most via COVAX equitably as part of a longer-term response to the COVID-19 crisis, which addresses the structural inequalities that we've heard about this evening, to which COVAX is only just the start of addressing. And importantly, and this is really important because it links back to, again, earlier things we talked about, the overall aid budget, we're really asking, critically asking for these vaccines to be in addition to our existing aid commitments and not paid for out of the shrunken UK aid budget. We all know it's been slashed recently and there's not enough money in there to do this. Then this needs to be on top. It's vital that this emergency response, delivered in extraordinary times, is itself an extraordinary response and isn't done at the expense of other vital areas such as nutrition, health, or education programs. Two very last bits of housekeeping before we say goodnight. One, in just a second, we're all going to ask you to smile for a screenshot that we'd like to use to highlight this amazing grassroots network of volunteers that make up results. As always, if you'd rather not be in the photo, then please do turn off your video. But otherwise, if you would give us a smile and a wave in just a second while Ruthie takes a picture. Ruthie?
Yeah, smile and wave. Okay, let me press the right buttons. And one more so I can fit in the 2 pages. Thanks, everyone.
Magic, thank you so much.
Bye.
And oh, last but not least, please do mark your diaries. Our next Grassroots conference call will be on Tuesday, the 6th of July, at the usual time of 8 p.m. And thank you all for your efforts on behalf of Global Solidarity and Equality, especially during National Volunteers Week. Thank you for your concern with what we've been discussing tonight. Good luck with all your campaigning and enjoy the rest of your evenings. Thank you, everybody all over the world. Special thank you to Vancouver. Have a great night. Have a great day. Take care.